Hello and welcome to another episode of Mask or Peace Theater. I am your host, Professor James Pretentious. Join us this week as we look at the vaccine. What is it? Should you take it? Should you not? These could be life-altering decisions. You need to hear what this panel of medical professionals has to say. Keep watching.
So let's talk about vaccines for a minute, because there's going to be a vaccine coming. I know that the speed at which we are attacking this is unlike anything we've seen before, and that gives some people pause. And I know, Andrew, for example, because you're not only a healthcare worker, but you're also in the military, that you probably don't get a choice in the matter.
I do have a choice.
Oh, you do?
I do have
Okay.
a choice.
Yeah.
I could go into house painting.
Right. I was gonna say, yeah, that's right.
There's always a choice.
There's always a choice. I could give up both of the careers that I love
Yeah.
and my livelihood.
Uh-huh.
Do something else that I would love to do in life.
Mhm.
But honestly, I will be essentially more or less forced to get it. I am Tier 1A for release according to the state and federal release of priorities. So I personally don't hesitate in doing so. I already get lots of vaccines anyway for military. I subscribe to that because it's a career that I feel like I'm willing to do that, to be able to do the job that I get to do.
Sure.
That's the price I pay for being able to do what I do.
Yeah.
And I'm okay with that.
So, go ahead.
So, and in terms of the vaccine, yes, you're right. There is one coming. The timeline, that's always up for grabs. But I feel like the companies that are trying to rush produce, I believe personally that from what I read, that they are following the proper protocols. I would trust this vaccine that comes out as much as I would trust any other vaccine, and I would still consider it for myself personally worth doing.
Okay.
I also believe that one vaccine is not going to be the end of the story here. Your flu influenza vaccine has to change all the time.
Yeah.
These things, we've already seen coronavirus mutate into a minimum of 3 different versions. There are probably even more versions that you guys are familiar with, but I know of at least 3 different versions.
Yeah.
And some patients who had gotten coronavirus back in March, April timeframe, there's been a certain percentage of reinfections by the same strain as well as additional strains.
Sure.
And the outcomes from that sometimes are more severe than the original course. There's debate as to whether or not that is the body's immune system in those particular individuals having more exaggerated response. And so therefore, if you get the vaccine and you are one of those people, just because you have the vaccine doesn't mean you're necessarily protected. You could essentially get the actual infection and get reinfected. It may be worse, or chances are the evidence is saying that it would be less of an infection. So the fact is, it's a moving target.
Yeah.
We're going to be chasing this for years, if not decades. We're going to have to roll with the punches.
So if we sort of focus in a little bit on the nature of the vaccine. So a vaccine, by its very definition, is something that the scientific kind of process requires a great deal. It's intense. It usually takes a very long time. From what I've read, this sort of expedited process means not that they do less safety measures, but rather that they remove certain regulatory hurdles to actually start those what do you call them, trials and that sort of thing. But we've even seen in the news times when they've pressed pause, so which indicates that they're being very careful, right?
That's normal for any vaccine development.
Okay, so what do you think, and this one I'll toss over to Jessica, what do you think is the reason why people seem to be afraid of they look at this and they say, oh no, it's rushed or this or that or whatever. What do you think it is that motivates people to sort of resist or be afraid of taking a vaccine?
Besides the implanted chip.
Well, it's interesting. I mean, I don't know Alan's take on it. Most of my colleagues that I talk to are concerned about getting it. So I don't know if you guys, it sounds like Andrew's cool with it. I personally have concerns about it. One of my bigger concerns is the leading one, Moderna, is using completely brand new technology.
What
That's
makes
an
it new?
It's a messenger RNA. So basically, layman's terms, you know, you have your DNA, which is the king. You have your village, which are the cells. RNA is the messenger that takes the order to the village, the cells, and tells them to do something. So this vaccine that they are coming up with is basically taking somebody else's DNA or something else's DNA and putting it in your body and telling your cell to make something. And so that's a completely new technology. Usually we just inject a piece of the viral protein and your body sees it and reacts to it and creates antibodies to it. This is telling your cell to make something.
Oh, okay.
And so you don't know what response you're going to have to that. I mean, how long is your cell going to be making this virus? Is this virus going to mutate in your body? You know, what else is in that DNA or RNA that your body is going to start making that is foreign to your body? And that can create issues with autoimmunity and cancer. And these vaccine trials, they go for about 8 weeks, is how long they look at long-term effects. So it doesn't even, that's not even the definition of chronic disease.
Yeah. So we have in this moment, there's potentially a great leap forward in our understanding of how to create vaccines, but there's also uncertainty about what that may mean for us. And
There's a lot of potential.
Yeah.
A lot of potential with it, but it is new.
Yeah.
It's new. I've had some colleagues express some concerns with that, especially just because of the rate it has been. That was more specifically with the RNA vaccine. I know that Pfizer's coming out with a more traditional vaccine. It's more well-known, well-tested, and that's actually, my understanding, that's the current front runner. That's the one supposed to be having results in late November.
And that's like an influenza primer, but with the COVID protein component.
Exactly, right. And so
it's known technology. It's known.
And there, you know, anytime you have something going at great rates of speed and you know, we hear the word unprecedented thrown around a lot. Well, it is. I mean, it's amazing what they've been able to do with the resources. So typically when we're talking vaccines, we're talking a decade down the road.
Right.
So what we are seeing is amazing. I do, you know, there are 2 different companies that are trying the RNA vaccine, which is new technology. And so I understand the concern and the hesitation with that. What I would say, a good litmus test in my mind, if you guys do have concerns about it, here's that buzzword again, ask your doctor if they're going to get it. I mean, put it on them. I mean, we're healthline workers. We are typically considered in the front line. Assuming primary care, I don't know exactly where they fall, but I'm assuming they're going to be up in the front line as well in the first step, the first stage. If you have concerns about it, ask them if they got it. And that's, I mean, it's hard to lie about that. Either they trust it enough that they're going to get it, or they're going to have hesitation and they'll tell you they're not going to get it.
So
And they're going to know in your particular situation what your risks are. And just because you come up with a vaccine, or even 4 or 5 different vaccines from different companies with different approaches, doesn't mean there's a pre-COVID world and a post-COVID world. That's not going to exist. It's a form of mitigation. And to get a vaccine is a form of mitigation. It's like choosing to wash your hands. Is there an ethical issue around not getting the vaccine? I feel that it's, you know, aside from my job and what I do, and I'm going to choose to do that, I certainly could go do something else. I could refuse to get the vaccine. And I feel like it's important that everyone still have that free choice. This is just one method. It's one tool that's used. It's not the tool, and it's not the end of COVID.
yeah.
This is not going to stop it.
This is your pastor's illustration machine working right now. You know, we have laws against child labor in this country.
Don't say I want that. I don't want that many Legos in my house. Let's just get that clear right out the bat.
Because you step on them.
Yeah.
You step
The
on them.
Legos, not the kids.
The Legos. Yeah, stepping on the kid, they're soft.
Right.